Obviously, I'm by myself today. Carol Truitt is my partner in dentistry. Many of you probably know Carol. He's been in practice in Atlantic, Iowa since about 1964. He's been my partner in developing this mobile model of geriatric dentistry that takes the care to about a half a dozen nursing homes in the Atlantic area. I'd like to thank Delta Dental for helping us with a generous grant to fund this program that started up about 5 years ago. Between Carol and Delta Dental and a strong hygienist and the partnering facilities that were willing to work with us, it's been a successful and a growing program. Today, I'm going to go quickly through an overview of the program. The program that I developed in Atlantic, Iowa was based on a model of a program that I created in Kansas about 10 years prior. Okay, we'll talk about the business model, about the value proposition and how we communicated that to the local providers at the area nursing homes, to their patients and to their family members. And we're going to talk a little bit about the financial model, that's startup costs and just operating expenses for the model. So how it all started, it started out with this relationship, this informal relationship I had with my dental hygienist in Kansas. She'd been cleaning my teeth, every 6 months, and she'd been coming and doing some in-services for my aides to help them to be better at the oral hygiene for the nursing home residents. And we'd had this ongoing conversation, and then there was this, one day we were talking, so I was getting my teeth cleaned, and there was a House Bill 2161, the Extended Practice Act that had been passed in Kansas. And we also discovered that there was some grant funding available through the United Methodist Health Ministry Foundation about this same time in the fall of 2002. And I was taking this entrepreneurship class in the MBA program, and just all these things kind of came together. And I had read this article on some of the factors that lead to people having to move from the community into nursing homes, and one of them had to do with the change in the oral health condition of people. So all these factors kind of came together, and suddenly it clicked one day when I was getting my teeth cleaned and talking with my hygienist, and we decided let's go for write a grant to start a mobile geriatric oral health program for the nursing homes in the area. They're in rural Kansas. Here are my partners. There was Maggie Schmidt and Dr. Brett Roofs from the Newton, Kansas area, and we worked together to leverage the grant funding from the United Methodist Health Ministry Foundation to pay for the startup costs, and Dr. Roofs was the supervising dentist, and Maggie was the one who hauled the equipment all around about a 30-mile radius from Newton, Kansas. In the first 6 months, this kind of describes the practice. The average age was 83.9, about the same as yours, and then it was 3 to 1 as far as women to men who were being seen. There were about 40% of the people didn't have cavities, so 60% of them did and had to be referred elsewhere. In Kansas, the way it worked, we were just doing prophies there in the nursing home, and if they needed further services, extractions or reconstructions, we had to refer them to a dentist and get them to an office somewhere. There's the number of teeth, the number of broken teeth. 92% had gingivitis. 13% had periodontal disease, a third of them had a dementia diagnosis, and a third of them didn't have a family dentist. This was an interesting thing for me. Our total sample was 96 people, and you can see of the 32 who did not have a dentist, 75%, let's see, what was that? I don't look at these that often. Okay, so I had 32 of the 96 didn't have a dentist, and we had 57 of the whole sample who had to be referred. 75% of the sample who didn't have dentists had to be referred for further care after they had their teeth cleaned, and of the whole sample, including those who had a dentist, about 60% needed to be referred for further care after they had their teeth cleaned. This was really a meaningful, important program to me because my mother-in-law was one of my residents at the nursing home, and she suffered from Alzheimer's disease. When I looked at the sample of 96 people, there were a third of them who had a diagnosis of Alzheimer's disease. And if you know someone who's had Alzheimer's disease and they can't tell you where it hurts, and it's traumatic to take them someplace unusual, and if you can provide the service right there where they live, it's going to be less traumatic for them, less traumatic for family members and staff. As we've said throughout the day, it's less expensive. It's just a win-win for everybody when you can bring the service right there to where they live and provide it to them in their home, maybe with their favorite aide holding their hand or helping them into the chair, or a family member who lives there in the little town who's there when the hygienist or the dentist are working with them, instead of them having to go to a strange place and then someone starts putting their hands in their mouths, you know, the whole thing, how confusing that would be. But I think it's especially beneficial for people with memory loss problems. There's Carol Truitt and Tammy Truitt and Sid Lindeman, our hygienists who we started the program with. Our first patient who we saw hadn't been to a dentist for 6 years. He'd had a stroke and he was paralyzed on his right side. And you can, if we go out to have our teeth cleaned every 6 months, you can imagine how much trouble someone would have who has had a stroke or who's got severe arthritis, or who's got dementia, who can't remember, who have to be cued to brush their teeth and then they don't do a very good job. So it was really gratifying to think about how much benefit we could bring to people in the nursing home, especially to those people who were there receiving services as a Medicaid beneficiary. An important part of getting our program started was the communication piece. We started out with an executive summary that just kind of boiled it all down in one page so I could talk to the other administrators at nursing homes and say, this is the program, this is the value proposition, this is how it can help you and your customers to save you money and help your customers have better health and well-being by bringing this service to them and doing it on a regular basis. So there was the executive summary for the nursing home administrators. There was a letter to the family members that talked about this is why it's important, and we want to bring this service to the home where your loved one is, so that they can have it right there, and it's less, it's not an inconvenience for you or the facility. It saves money. We priced the service competitively, so it was the same price or less than they would pay by taking him out to a dentist's office. Had a basic consent to treat form, and we collaborated. We were open to working with the area dentist. It wasn't like this dentist was trying to take business from somebody else, but these were people who couldn't be seen by their regular dentist or hadn't been because they were just so disabled. So we always got the name of the family dentist in case they wanted to be referred or in case that dentist wanted to continue to work with them if we discovered a problem. There was a letter to the dentist. One thing we discovered in Kansas was that you needed to communicate with the local dentist, not just come in and, but explain the service and talk to them about, hey, don't be threatened by this. We're trying to partner with you and help you by serving the people who can no longer get to your office. And then we had a most frequently asked questions piece that we give to everyone when they come into the nursing home to help families understand the service and to help the social workers explain the service to family members and residents. MOS, that's the Miles of Smiles. That's the name of the program that we have in Atlantic. At the Atlantic Heritage House, that's one of the Wesley Life campuses. There are about 7 of them in the state. And so the Miles of Smiles practice operates out of there, and we serve about 6 or 7 other nursing homes and assisted livings in the area. Some of them are Care Initiative, Good Samaritan, and then some other independent facilities. After 4 years of operation, we've had 353 different patients, 156 patients currently served. We serve 7 nursing homes and assisted livings, a little over 50% Medicaid. It's 2 to 1 as far as the females, women to men in our patients. And so far, year to date, we've had 257 preventive service visits, 44 diagnostic, 19 periodontal, and 20 adjunct visits, service visits. In Kansas and here in Iowa, we got our startup money through a grant. It paid for the equipment, and then we had a budget set up so that with the rates that we charged, it was kind of a blended rate where about half of them paid the full amount and half of them were reimbursed from Medicaid. So it was equated to about 75% of what your regular rate would be when you had half of them paying full and half of them paying, being reimbursed 47 cents on the dollar. We were able, it was a sustainable program once we got it started, but we needed the grant money for the startup costs for the equipment. We partnered with other providers. It's kind of a counterintuitive thing because working with the other nursing home administrators in the area, you're helping the competition. But it's exciting to see the difference you can make in people's lives by improving their oral health and their health and well-being. So when you explain to people, this is what it is, yeah, sure, I'm the guy competing with you down the road, but what we're doing is we're working together to help elders to have better oral health and to enjoy life more. It reduces the turnover in your beds because people live longer, they're healthier, they're happier, there's less complaints. In selling administrators on the concept, the thing that nursing homes get in trouble for, things like skin breakdown and weight loss and pain, it all starts in your mouth, like everyone's been saying all day. If we can address this problem on a preventive basis, we can help people to live longer and live better lives, and it's a win-win for everybody. So we had to communicate the concept to the nursing home leaders. In Kansas, what I did, I got all of them together with the administrators, the directors of nurses, social workers, and the office managers, all these people who we needed buy-in from in order for the program to work and for the service to be able to be rolled out smoothly in the different communities, because everyone was different. They had different forms that they wanted to use in their medical record, and the bookkeepers we would send bills to, they needed to understand the process. The social workers needed to understand the service because they were going to be explaining it to families, and of course nursing had to understand because they had to get people ready, get them into the chair, get them, get the antibiotics for some people who needed that ahead of time, and so on. So there was a lot of marketing to the other providers and then explaining it to families about helping them to understand the value of the service, that if we can work on their mouths and control bacteria, it reduces problems that are exacerbated by the bacteria, like heart and pulmonary and diabetes and all the other stuff. Some of the major challenges and drawbacks of the service were just that regular communication, getting people all on the same page to be sure that the nursing home down the street was ready when the hygienist pulled up with the van, so that there were people there to help unload the equipment, so that the nursing staff had their residents ready to get in the queue to have their teeth cleaned that day. Then working with the bookkeepers to be sure that when they got our bill that they knew what to do with it. So working on the communication piece. The transportation is probably the biggest challenge for the mobile programs that I've been a part of because you have to haul this equipment that's kind of awkward and heavy all over the countryside, and one hygienist just used her SUV to haul it, and then we had a van that we hauled it in from Atlantic for a couple of years, and it wore out, and we got another one with some of the profits from the program that had a ramp. It was handicapped accessible, so you could roll it in there and roll it out. And you need dollies and stuff so that people won't hurt their backs when they're hauling the equipment around. But the transportation is an important part. If you can't get it from A to B, you can't provide the service. And just ensuring quality through good practice and good equipment, good communication. The supervising dentist is on top of things. In writing the grant, we had to have a lot of synergy from the people involved. The dentist knowing what equipment was needed, and he helped with the shopping list and working with the hygienist and to build the case and understanding the demographics of the area, so you could help explain this is the population we're trying to serve, and this is, there's not enough dentists, and there's this many nursing home beds. Just understanding your target audience, your target market there, and defining the need. Being able to work with the grantor and giving them what they want, not answering questions that aren't being asked. That's another important thing as you're writing a grant to try to develop your case. It's all driven by the organization giving the grant. So you need to help them understand how your program meets their needs and satisfies their mission. And we've been fortunate to be able to work with Delta Dental, who's helped us to get our program going and to get our programs, show how our program meshes with Delta Dental's initiatives to help underserved populations in the state of Iowa. Then we had to have a strong pro forma budget that looked at all the expenses that went into the program, that had an accurate estimate of the revenue, and you looked at utilization rates of equipment and so on, and looking at the financial side. When it came to seeing the patients, I was fortunate to have Dr. Truitt as my partner, who's been innovative over the years and ahead of the curve and working to guide the program and oversee the daily operations. So we had innovative leadership. We've had good equipment, state-of-the-art equipment to bring to the facilities. Requires a strong, flexible dental hygienist, and strong in every way, because they do the heavy lifting both figuratively and literally. Yeah, because one of our early hygienists isn't there just because it was just hard on her back. So you got to really think about your staff and make it easy for them to do it, and work with the facilities, be sure there's a maintenance guy or someone there at the other end when they pull up in the morning to help them unload that equipment and get it set up, whether it's in the shower or the beauty salon or the activity room or wherever. Then you need buy-in from the facility staff. The nursing staff needs to, oftentimes the nurses, they were the ones who said, we got to have this stuff. They really were anxious to see the dental services brought to the residents. But then you have to get everyone else on board, like the social worker and the bookkeeper and the administrator, to help them understand how much value this will create for them by providing this service in-house for these people who can't get to the dentist otherwise, and understand the preventative aspect of it and how it can help keep them alive longer, give them a better quality of life, reduce other health problems. Then just over-communicating with all the different stakeholders so that they're ready for you and it works. So in selling the idea, again, you have to get the buy-in from the aides and the buy-in from the nurses so that they all understand the importance of this. It's not just another thing we have to do. We have to move the patients here so the hygienist can see them today, but help them to understand, how important this is to the health and well-being of the people they care for. And then, getting other people, your competitors to understand the concept and work together, because we're not going to try to take your customers, and we're going to help you to do your job better. We're going to help you to be more competitive by having this service. You can offer your residents and their families right here on site instead of having to send them miles away and taking your staff away and incurring these additional transportation and staffing costs. So there was use the executive summary again. We're in Iowa. If you feed them, they'll come. So have food there, bring people in to explain the concept. So So sell the facility leadership on the concept, and you're good. You know, it's like, oh, you know, make my life easier, make my business stronger, make me more competitive, add value to my list of services. So from the patient's perspective, it's inexpensive or at least competitively priced. You know, we, in Atlantic, the price we have for that area, it's like $85 for the cleaning, and we have a $20 charge for the fluoride varnish. We serve both private pay and Medicaid. The Medicaid, you know, we get 47 cents on the dollar, I think, reimbursed. We serve this underserved population. There's all these elders who used, you know, like the healthy people who are out there working at the facility. They go to the dentist every 6 months. These people who live there now can't get to the dentist, and especially the ones on Medicaid. It's like they're neglected, and they don't get there. You know, they have even more of a problem getting out. Health benefits: it reduces pain, reduces risk of weight loss, reduces risk of skin breakdown and exacerbation of these other problems with the heart, lung, and diabetes. It's like, you know, why wouldn't you want to do this service? Why wouldn't you want to offer this service to your customers, your residents? The downside, you know, interpreting the service to the families is one of the best kept secrets we've got there, I think, at the facility. It's just, you know, we have to keep it in front of the people who are admitting residents to the nursing home to say, this is a service that you can provide your loved one. So we have to continually remind the staff, and as there's turnover at other facilities, help them to keep that information available to give to people so they don't forget that the service is there, since it's, you know, it doesn't come every day. And as leadership changes, you have to go out and sell the concept again to the new administrator, the new DON. There's different forms at each facility. The way we do our billing, we send out, at the end of the day, after the Medicaid residents, you know, those who are on Medicaid, when they've been seen, Dr. Truitt just electronically bills Medicaid. Those who are private pay customers, we send a kind of a group bill to the facility. You know, if there were 6 people seen and 3 were private pay and 3 were Medicaid, he'll bill Medicaid separately, and we'll send a group bill. My bookkeeper will send a group bill to that bookkeeper at the other facility for those 3 people. They'll send me one check, and they'll be responsible for collecting from all the individual people by adding that charge to their monthly statement. That way it's easier at my end. My bookkeeper doesn't have to be sending out 6 bills or 3 bills or whatever, and I'm not getting involved with my, you know, other people's customers. We just work directly with their bookkeepers in their office. Then just the equipment costs, replacing things as they age and break down, and transportation, as I said, is the biggest challenge, I think, for us in providing the service. You have this great equipment, you got staff, but you got to move it around. And you know, when the snow's 6 inches deep, or you know, when you have a less than ideal space to move it into, or you know, 100 foot to move the equipment through a hallway once you get to the facility, getting it from point A to point B can be a challenge, but it's doable if you have you know, dollies and support staff to help move it around. So we have our hygienist who's hardworking. We have our dentist. We have state-of-the-art equipment, a strong collaboration with other providers, and we are able to ensure quality control that way, and just keeping the communication lines open. As we built our budget and putting together the grant, we looked at how many nursing home beds were out there in the area that we were trying to serve, looked at the number of dentists out there, used Iowa Department of Public Health statistics, and we you know, to understand the size of our market, and then make some projections about how we thought the service would grow. We looked at our startup costs for equipment. We looked at what we thought we could expect for our operating income with a small group of people to begin with, and then as that population grew, and then we were, you know, taking into consideration that about half of them would be on Medicaid. We looked at our payroll expenses, our supply expenses, and what it was going to cost to keep the thing on the road, and put all that together in our pro forma. to make sure that the thing would cash flow once we got started, got our operating costs covered, then it would cash flow with the proceeds from the services from private pay and from Medicaid. And we just had we looked at over 5 years and to see kind of how we thought it might grow, and using the number of nursing homes and patients at each one, and basing it on just a limited percentage of people at each nursing home. And just looked at it from several different perspectives, trying to understand how many people we could serve and how the program might grow over the next several years. And all these numbers and slides will be up on the website. So that's it. It's we get out there. It depends on the schedule of the facilities, how many people they can line up who need to be seen. We're out there about 1 day a week because the hygienist who serves the program, she works in an office the rest of the week, but she's out there at least 1 day a week in one of the facilities in the area, and then there's some Saturdays where we do some work.
Just because they're recording, they asked me to ask the question again over the microphone. I was asking how many days a week, okay. And his answer was basically one, usually.
Yeah.
Thank you so much. I just want to say Tama Truitt is a former student of mine. So that was awesome to see her, and she's doing so well.
She's great to work with.
She's a fantastic gal. This is for the both of you. We saw the x-rays of the person 2 years later. We saw the data on the needs and the providers. So what are your recommendations to keep that from happening in the future?
Fix it now.
I do think it needs to be a collaborative effort. It does have to come from both sides. If it doesn't come from both sides, it's not going to work. I mean, we can have the fiscal cliff, or we can get together and decide, we're going to work together. And I think that's what it's really going to take, is two groups working together, understand the need from both sides, and make it happen. I do think that from the dental profession perspective, that from what I see in the young dentists coming out, now our program, there are many students who come through that program at a very young age that see these things and it's an eye-opening experience. It's very difficult. There are very few students who come out of the program at this point in time that think that experience was negative. Most of those students come out with a very positive evaluation, very positive evaluation. That doesn't mean they're going to run out and do it when they get done. But my hope is, as the data shows, that most dentists, as they get in their retirement years, or when they're thinking about doing something else other than focused on their profession and their money that they've accumulated, that they might have more of a public health perspective. If I hope that that's the only thing, then this could be a long time coming. But I hope that that's not it, and I don't think it really is. There's a number of students every year that want to go out immediately and start doing this kind of thing. That's not a lot compared to the need that's out there. But I do think that part of that is the dental profession talking about the need and make it known that these places need to have that. Making it a bigger part of the profession's responsibility. And from the nursing perspective, it has to be their responsibility as well. It's just not going to work one side or the other. If the care professionals in the nursing facilities don't bump up their ability to want that care for their residents, it's just not going to happen. So from both sides, I don't know. This is a good start. I think a summit with the leaders of both sides can come together and make some things happen. And I hate to say that more regulation is needed because, you know, who wants more regulation? Why can't we just do it? Why can't we just do it because we know it's the right thing to do? And as Dan was saying, you know, why not? Why wouldn't you want that for your residents? If we can do it that way, then, and there's help from both sides, that's my perspective, is we need to get together, though, the leaders from both sides.
And from the provider side, if you can help build that value proposition, help them to see this is really going to help you because it's going to reduce the rate of rehospitalizations. It's going to help reduce turnover rates because people are going to live healthier and longer. You know, so your beds are going to be fuller longer, your customers are going to be happy, you're going to be less at risk for regulatory problems because they don't lose weight, they're not in pain, there's not skin breakdown. You know, building that value proposition by just saying, this is the facts about how better oral health care will lead to better outcomes in among your patients, among your residents, and in your business. I think, you know, that, you know, you're talking about the bottom line there. And getting the aides to understand it, you know, okay, you say you care for these people, let's really, you know, do you understand how important, how vitally important it is that you keep their teeth clean, their mouths clean? You know, that's going to make their lives so much better, you know, if you can just get them to understand that. And maybe it needs to begin with understanding how it affects their own health, and then they'll say, oh, I can help someone else's health too.
I said that 6 hours ago.
Yes, you did.
I have a question, because I know at nursing homes, the administrators probably go to some kind of national conventions or local group meetings. And at those meetings, isn't that where the dental professionals should be there talking to those people to get the word out? How important when you're building those facilities to incorporate some sort of a dental clinic. I mean, if you can put a beautiful dental salon in your assisted living, certainly you could put in some place where you could bring the dentist or the dental hygienist in. Seems like a no-brainer to me. I mean, my parents go every month and get their toenails clipped because the doctor brings that in and Medicaid pays for it. So why wouldn't you just do that for your hygiene? It just seems so simple.
I think it's starting to catch on as evidenced by this meeting today and Delta Dental's involvement. I put together a proposal to try to do something like this at the national level recently, and it didn't get accepted. But I think you're going to see more and more of it as we look at the connection between, look at the outcomes that it can create.
Hi. Our challenge in one of the nursing homes in Indianola where I work at is that we do not have local dentists to come to our facility to do examinations and stuff. And some of the families are not willing to go with the residents, so the staff has to go, with the residents. And so do you have any contacts closer to Indianola, and if you guys are willing to travel further? Because we are willing, our nursing home is willing to, this kind of program.
Yeah, well, we've actually tried to have a network of dentists and associated in various districts throughout. That seems to have... At one time, I don't know where that came from, but we had a network and a pilot program that was supported by Delta, the same foundation that's here today. And we had tried to line up dentists with nursing facilities. So it has to come from the administrator, the director of nursing, and I've gone to facilities before. Being from Iowa City, I like to keep in town if at all possible, and there is a facility in the town that I've gone to that doesn't want us. and just flat out says they won't pay the setup fee, which is a $500 fee to plug in our system. They don't want it. It's too much money. So those are the types of barriers that need to come down. I don't know your position in the facility, but the facility needs to decide that it is important. It's hard for me to believe and hard to understand. This facility has half their beds empty, and $500 is too much.
Okay, I'm bringing in a note of, to me, I think is interest from my May dental meeting. And when you talk about situations where family members don't want to get family members to the dentist and you can't get dentists in-house and things, I think if you would use the term supervised neglect and see if that doesn't register with people, because I think that's a very, supervised neglect. Pass that.
My 2 cents worth. Can I leave now? All right. Well, thank you very much.
On behalf of Delta Dental of Iowa Foundation, I would like to thank you for taking the time to come here today and learn and participate and engage in the discussion from our wonderful presenters today. So if you could give them another round of applause. And I'd like to thank also a variety of people who are representing different industries today, and the ability to come and listen and be open to the possibility of future engagement. And with that future engagement, I want to talk about the next steps. Today's event is designed to bring a diverse group of key stakeholders to learn more about the oral health population that's affecting the aging in Iowa. And what we wanted to do was to educate, not provide any sort of specific agenda, just educate, give you models, give you ideas about what is happening nationally and what is happening here in our state. In 2013, we'll be hosting 2 more sessions, and those sessions are called Motivate and Activate. And they will continue the conversation, develop a dialogue and plans to initiate opportunities for collaboration. And what these 2 events are really about is about trying to throw some things up on the wall and see what stick and what will work. And we know that not everything will work for every area of the state, but what's important is that the people around the state who represent and are involved in the day in and day out are actively involved in that planning process. And what we would like to do is, again, let you go and vet and think about what you've heard today, and think about what you can do as we move forward, because we will move forward. It is Delta Dental of Iowa's Foundation's, one of their primary goals is to move this agenda forward and to support the current work that's being done in Iowa and the opportunity to further advance for access to care for homebound elderly and nursing home residents. So have a great weekend, and thank you again for your time.